have, patients whose birth narratives are something didn't click the first time around, and we had a primary C-section, and now we're returning with a new pregnancy and different risk factors, or it's a low-risk pregnancy where the last one might have been a high-risk pregnancy, and they're really appropriate for a trial of labor after C-section. Pretty intuitive what the risk might be if we're going to labor on top of that C-section scar. There's a risk that C-section scar can separate. So our typical protocols follow consistent with our college, the CNM College and the Physician College of Obstetrics, as well as the protocols from the hospital. We do continuous monitoring to make sure that we're not seeing that intolerance of labor, to try to help people achieve a safe vaginal birth after C-section.
My role in that also is to, besides facilitating safety, is also facilitating birth wishes and trying to incorporate that into our protocols for safety. So usually if we have a patient that would like to discuss a TOLAC, we have them come in and talk about that first with their midwife, and then we will have them do a consultation with one of the physicians. They will come in and look at their operative reports, look at their reasons for their cesarean section, and discuss with them the risks, benefits, and what they think the possible outcomes might be for them.
I think also the biggest risk with a VBAC is not the scary one. It's actually just the risk of failure. That's the hard word, and I hate that word failure. But a lot of people carry that to their hearts, and I don't think it's not a failure of your body. It's just a different way to birth. I don't like the word a failed TOLAC. Just not a successful one.
Correct.
I think that's a better way to say it.
On that note, our success rate with TOLACs, who actually VBAC, which means vaginal birth after cesarean, is around 85% for the last 12 months. So, and a lot of that is just that we do a lot of education and making sure that we have great candidates for the TOLAC process before we enter into that agreement together.
An agreement together. That's really nice.